Hello everyone and welcome to AceOSCE's video for today. Thank you for joining me, Alicia, and in today's video we will be walking through a case instead of actually performing it, just so that I can give you more tips and give you a little bit more idea of how to solve an OSCE case and what things to keep in mind. In today's case, we will be going through a medication review where you will be expected as a pharmacist to conduct a medication review and make sure that the current regimen is correct for the patient who's coming in. Let's get started. So guys, whenever you go inside your station after reading the door note, you will see an assessor and usually some references or some profiles on the station in front of you. In this case, because it is a medication review, you will see a patient profile, and in case there's any reference that is needed. In most cases, you will not get a reference in case of a medication review. So when you see the profile in front of you, of course, you have about 20 seconds to go through the reference and the profile. And when the patient or the patient comes in, make sure that you introduce yourself and greet them. You also want to make sure that the profile in front of you is current and correct. So make sure that you're talking to the right patient. Confirm their name, their age, medication history, any allergies, their current medications. Of course, social history is important as well. Now, you can do this in a few ways. When they do come in, you can either ask them to sit and then start going through the medication each one at a time. You can extract the entire medical profile from them, so ask them everything on their own, or you can actually go through the profile together and ask them if there's any changes or any additions that are needed. I find that the second way is much easier because you have the profile in front of you and there is lower risk of missing any information. Making sure that you have all the correct information, make sure that you have the correct dosage, you have the correct frequency of them taking medications, and it's also a good idea at this point to ask them how they're taking the medications and if they're taking them as prescribed. Now, I also want you to remember, guys, that especially for lifestyle diseases such as hypertension and diabetes, social history or lifestyle does play a major role in the management of the disease. So make sure that you ask them about their smoking status, any alcohol consumption, what sort of lifestyle they have, if they're active in terms of exercise or they're sedentary in terms of their work. Make sure that you ask any women of reproductive age if they are currently pregnant or breastfeeding. In those cases, especially, knowing the pregnancy or breastfeeding status can make or break your case. If you don't ask them that and they are pregnant and you give them, say, an ACE inhibitor or an ARB, you are done. So make sure you do ask all these questions. These are very, very important. If you do have the time and you think it is relevant to the case, feel free to ask them about their vitals, such as recent blood pressure reading in this case, heart rate or pulse, weight, as well as height. In terms of lab results, if they have any, it would be a good idea to have that as well. In order to conduct this medication review, make sure that you have a few things in mind or a little bit of an idea of how to flow through the case. Doing the patient interview in the start is the best way. So first you greet the patient, confirm their identity, review their medication list, which includes the medications, how they are taking them, how often they are taking them, and if they're taking them as prescribed with the desired outcome, and ask about their adherence as well as side effects. Assessment of blood pressure is important. You discuss the patient's blood pressures, if they are monitoring it, if they have any current readings, and any potential pressure reasons for elevated readings. Medication counseling, so offer advice on proper use of their current medications, including how to take them, possible side effects, and what to do in case of missed doses, especially if it is a case where the patient has a concern about a specific medication. And lifestyle modifications, especially in this case, is very important, so do not disregard that. Counsel the patient on the importance of weight management, exercise, smoking cessation, and reduce alcohol intake to improve blood pressure and control. You should also keep in mind the lifestyle modifications, because they do play a big role. You can also establish interprofessional collaboration by offering to refer them to a dietitian in case they are interested, because having a healthy lifestyle or a healthy diet, in case they're not able to have one at the moment, is really going to help improve the outcome of their hypertension, and also in case of their joint pains, and because it will help with weight reduction. In terms of this specific case, keep in mind that you will be assessed on various areas, including number one, and very important, is communication skills. So make sure that you're listening actively, asking open-ended questions so you can elicit as much information from the patient relevant to the case as possible, and ensure the patient is comfortable and engaged in the discussion. So have eye contact and be confident. Clinical knowledge again is very important, especially because in such cases you may not get a reference or you may not even have the time to go through the reference. So be prepared to explain any mechanism of actions, side effects, and expected outcomes of each medication. And the most important crux of each case is the problem identification. So going through the medication profile, taking down the history, and conducting a medication review would involve seeing any potential problems and correcting them. So understand common issues in hypertension management in this case, including drug interactions, non-adherence, lifestyle, and potential complications. So guys, in general, when you're going through an OSCE case, especially a medication review case, have effective communication. So build a good rapport with the patient, understand their concerns, provide clear instructions. Medication management, of course, is very much important. So identify if the current regimen is adequate or if there are any signs of non-adherence or drug-related issues. Make sure that you have offered the patient interprofessional collaborative methods such as talking to their doctor or referring them to a dietitian in case needed. Patient education, so providing clear, understandable, and personalized counseling on lifestyle changes and medication management. So in this case, you can go above and beyond by offering them a blister pack in case they need one, or if you can give them maybe a reference to a health rec center that is close by, so they can go swimming or they can improve their lifestyle. So just go above and beyond. Think how you can give information to the patient that will benefit them. And problem solving, of course. If the patient's blood pressure is not controlled, consider other medication adjustments or recommendations to improve management. So in this case, you can, in case this happens to you, make sure that you offer to talk to their doctor or ask them when their next appointment is in case they want to talk to the doctor themselves. So you just want to go above and beyond these cases to think how you could help the patient in order to manage their disease effectively. Keep all these points in mind. These are really going to help you guys out. So guys, this is the end of our video. Hopefully this gave you a little bit of an idea on how to flow through a medication review case. Reach out to us in case you have any questions regarding your PEBC OSCE or would like to book some PEBC OSCE sessions with us. We have one-on-one flexible schedules and some slots open. Links are in the description below, and we will see you in the next one.